it's my pleasure to invite Dr. Emma Cardelli with Boston Children's Hospital up on the stage, along with Dr. Sarah Goodrum with the University of Colorado Boulder, and last but not least, Dr. Stephen Geis, Development Services Group, Inc. Come on up here, y'all. We've got 2 mics here.
All right. Hey. You want me to squeeze? Okay. Hi. All right. It's a pleasure to be ending the day with you all. We promise we will end right at 4:10. I know there's going to be quick goodbye and then a very important survey that Neil will make sure you all fill out, but we don't want to keep you any later than anticipated. It's been a great day so far. So we're going to be focusing on communicating our evaluation efforts. And before we even launch into that, actually, I think it's just going to be important to kick us off with a few kind of important background questions to set the stage around what it is we're talking about. And then we'll jump right into communication of findings. So first and foremost, my name is Emma Cardelli, as Neil had already said. I'm a clinical psychologist at a Boston Children's Hospital, Harvard Medical School, and I direct a multidisciplinary violence prevention program. I'm the clinical director for that program at a Boston Children's Hospital. Sarah, you want to introduce yourself?
Sure. Hello, I'm Sarah Goodrum. I'm a sociologist and criminologist at the University of Colorado Boulder's Center for the Study and Prevention of Violence. We have 2 grants funded by the Department of Homeland Security. And as a center, we work to both do research, develop programs, and evaluate the effectiveness of those programs in violence prevention in schools, communities, and organizations in Colorado and around the country.
Awesome. Stephen.
Hi, I'm Steve Geis. I am the Director of Research and Evaluation at Development Services Group. We're based in Bethesda, Maryland. We have a number of grants from the National Institute of Justice and other federal agencies. Probably the one that is most relevant here is we run what is called crimesolutions.gov, which is an evidence-based repository programs designed to prevent crime and delinquency. And we assess a variety of programs to see if they're effective in doing that.
All right. Pleasure to be sharing the stage with you both. Steve, I'd actually like to ask you the first question here. So curious to hear your thoughts on what is the difference between performance measurement and evaluation.
Sure.
To set the stage.
I'm not going to give you a hard definition. I'll tell you the way I think about the difference between the two. I think performance measurement is more internal and evaluation is more external. And I'll give you maybe a little analogy or example. If you were running a prison or a correctional facility, performance measurement, you may look at things, and these are things that you could do on a daily basis, but you may look at things as how many people are in the facility, what is the length of stay, things like that, to measure the health of your program and what you're running. A program evaluation is more external, where you want to look at the impact of the program. And generally, you're going to compare that to other similar either facilities or programs or maybe a national average, things like that. So it's more external looking, if that makes sense.
Totally. Sarah, is there anything you want to add there? Or how about definitionally speaking, what is program fidelity? When we think about fidelity specifically, what does that mean? Why is it important to consider fidelity as part of an evaluation? Either of you, feel free to jump in.
Well, I think program fidelity is important to consider in evaluation of your programs because oftentimes the program we design and develop guidelines for is different once we're actually implementing it in the real world. And we oftentimes see gaps between the guidelines for a program and how that program is delivered to a population or community. And one of the things we want to try to understand in looking at the fidelity of implementation is, what are those gaps? How big are the gaps? And what might we do to address the gaps? Does that mean we need to reconfigure how we've designed the program? Does it mean that some of what we've developed is not culturally responsive or appropriate for the population that we're serving? Or maybe it's that we were a little bit unrealistic in how we thought that program would be delivered. It might be that we thought our population would be coming to our offices and we'd be able to support them in that way. And it might be that, no, we have to actually go to the location where our population is to deliver the services. So it's trying to figure out how realistic, what's the match between the guidelines we developed and how it's actually getting implemented in the real world, and how might we address those to improve it?
First of all, I mean, I agree with everything you said. And just to, paint a little picture about how that works. I mean, if you think about like a blueprint, right? You have a blueprint for how a program should work. And then when you're implementing that program and running the program, you want to make sure you're implementing like an architect. You have a blueprint for a building, right? You want to build that program according to that blueprint. And then you want, ideally, similar to the idea of performance measurement, you want to make sure that once it's built, it's continuing to run based upon the blueprint that you set out. And and there's different dimensions of fidelity, but just to give one that is simple, kind of easy to understand, you can think of dosage as a dimension of fidelity, in the sense that, again, if you're looking at a label of a drug and it's telling you to take one pill every 4 hours, you want to make sure that you take that pill, one pill every 4 hours. Because then when you look at the outcomes, if you didn't follow that prescription, well, is it because the program itself failed or the implementation was not followed? So you're not actually, if you're doing an evaluation, you're not actually evaluating that program. You're evaluating something close to that program, but not that program because it wasn't implemented properly. Does that make sense? Okay.
Yeah. Please go ahead.
Yeah, I often like to use the analogy of cooking, similar. You could start with a recipe and have all the best intentions of having a great meal come out at the end. I often try to follow Ina Garten's, the Barefoot Contessa's recipes. And no matter how hard I try, my enchilada never looks like the enchilada in her cookbooks. So, and if you make modifications, Ina says, use goat cheese. I'm using cheddar. I've varied my plan from the guidelines, and of course it won't turn out as well. But
one time used, I think it was paprika instead of cinnamon. It did not turn out well. Yeah.
Yeah, I can relate.
I really appreciate the way you're both kind of conceptualizing, talking about fidelity. I will say, as a clinical psychologist, as a clinician, oftentimes how people talk about fidelity in my field is around fidelity of an evidence-based treatment model, or clinicians then are trained in a particular evidence-based practice and they have to be faithful to that practice. And it's really lovely to hear you all frame this too as something that, when there are gaps, it has implications for the practice, for the program as well. And it's important to pay attention to that, rather than, in my field, again, how fidelity is traditionally talked about within clinical training. It just becomes, well, that clinician didn't get it right and we need to push harder. And that's a very important distinction.
I want to add a little bit to that, because fidelity is important. There's no doubt about it.
Yeah.
But in something that, all of you are doing, I'm sure, it is not always easy to implement a prescribed program with, like I said, a blueprint in the community. Because once you start trying to put it in your community, it may not always fit. and you may have to make some modifications. And I do think that's reasonable, but there's always the balance between fidelity and, I guess, fit. That is just something to keep in mind.
So important. So actually, piggybacking off of that, what do you recommend programs do like when it doesn't fit? Then what? And how do you track that, document that, communicate that?
I think that's actually an exciting opportunity for learning
Mhm.
about maybe where there was a shortfall in the training. Maybe there's a shortfall in the way the program was designed that you want to take back to the developer and say, okay, these 3 questions we're finding it difficulty asking them of our patients or of our educators. So I think that's an opportunity for learning. I think if you're wanting to really push forward and adhere to the plan for the program, you want to try to step back and say, okay, how could we provide maybe some technical assistance
Mhm.
or support
Mhm.
to sometimes it's just a gap in understanding why the process has been developed the way it is. And so helping the people who are administering the program see the value
Mhm.
and we've developed it this way for these specific reasons, and we really need your help in delivering it in this way.
Really just going to concur. I mean, I think it is important. I would say, I think it's okay to do. I think it's something that you do want to document because it is an opportunity to learn, right? So if you document a deviation, one of the biggest things that, money, maybe you don't have as much money to implement the program that you wanted and you have to cut something out. But anyway, so document some of the differences and then it's an opportunity to learn. Maybe you have a program that comes out better than the original. Maybe it's not as good, but it's an opportunity to learn going forward and to add to the body of research that is building on any particular topic.
Please, Sarah.
Yeah, one thing that we recently worked with 40 schools in Colorado on an NIJ study to look at the implementation of a comprehensive approach to school safety called Safe Communities, Safe Schools. And one of the things we realized in this project was that not all schools were ready to develop and implement a new school safety program. They're already overburdened. They're exhausted. I think everybody is exhausted these days, but particularly school staff. And so we have worked with a team of researchers to develop a readiness assessment of the school staff to see if they have the energy,
Yep.
motivation, and the knowledge needed to try to implement a new program. And that's been really helpful. Some of our preliminary research suggests that evaluating the readiness and then using the information about school staff's readiness can actually be addressed. So you can help bolster their readiness, address what the knowledge gaps are, help try to anticipate what the motivation issues might be, and then use that information to try to improve the readiness capacity for implementing the program before you actually start the program. And that has been helpful.
Such an important point.
Yeah.
The readiness issue is like near and dear to my heart. Very, very important. And, I feel like in our team, we think a lot about there's the readiness of the practitioner, there's the readiness of the system you're implementing something in, there's the readiness around the broader climate. It's just, there's a lot of readiness factors to consider that matter tremendously. And I often find that folks don't slow down enough to evaluate readiness before they jump into programming. Steve, were you going to add something there?
This maybe takes a little bit a side turn, but I think readiness and willingness
Yes.
too.
Yes.
Because you need to kind of have the boots on the ground and people willing to do the work. which goes to readiness, but maybe willingness is a part of readiness.
Mhm.
But you need to have that buy-in. So some people may be willing, but they're not ready. Maybe it could work the other way too, I'm not sure. But I just wanted to add into the part that, there's the willingness as the part of readiness is, I think, is also a key factor in being successful in an evaluation or implementation and evaluation of a program.
Yeah, so the buy-in piece to me gets back to, I mean, it's the communication piece, how you communicate, how you frame what it is you're doing. Can you all speak to, within your own programs, what have you found helpful in increasing buy-in? What has helped you communicate your goals or your findings most effectively to help increase buy-in to whatever it is you're doing?
Well, I don't run any programs, so
Mm.
I'm basically evaluator. I'm kind of the scary guy that's coming in. And often people are fearful when I sit down because they don't want to be told that their program doesn't work.
Mhm.
But in order to get that buy-in to do the evaluation,
Yes, please.
I'm willing to work with them where they're at, and you try to convey the message to them that we're in this. It's not an easy job to do some of this stuff, and just try to work with them for whatever the starting point is. I'm not trying to paint them in a bad light, and I'm not trying to say anything negative about the program. As a matter of fact, if you do have some negative findings, speaking to what we talked about fidelity earlier, maybe that's an opportunity to improve the program, right? At the end of the day, it gets down to cost too. So we don't want to be spending money on programs that are ineffective. But in order to where you're saying to get that buy-in, to convey that, I'm not necessarily the enemy, and we're all trying to get to the same end in producing effective programming for, whatever problem that we're trying to address.
A couple of I can think of 3 or 4 strategies we'll use to try to get that buy-in. One is we will use the readiness assessment
Uh-huh.
as a way of acknowledging you're already in a deficit situation.
Mhm.
This is going to be adding a little bit more work to what you already have going. But if we do it well, it may reduce your workload in the long run. So showing how other programs or organizations or schools have actually had positive outcomes from the program in the past. So showing those numbers may help to get that buy-in. Second, having someone in a leadership role serve as a champion for the program to keep people's enthusiasm up, to help them, remind them of here's what our long-term goal is, and hopefully this is going to make our lives easier down the road, maybe reduce disciplinary referrals or threat assessment cases if we're being more proactive with prevention. And then we will also provide coaching along the way, little check-ins with the people administering the program. And then we do try to celebrate successes.
Mhm.
So if, after 6 months of implementing the program, you're actually seeing some reductions in the outcomes or improvements in the outcomes, you can share that. And that helps people keep going and seeing that the work they're doing is actually making a difference and having a positive impact.
Steve.
Just to dovetail on the last thing you said, I think that speaks back to the performance measurement piece, is that if you're doing a performance, I mean, they can be separate, but if you're also doing the performance measurement piece, and you're tracking performance along the line, so there's you can say you can reward the improvements. And also, if you're seeing things are not on track, maybe you're not getting the referrals you want or whatever, you can make adjustments before you get down to the end of the line. So fix any problems that you have before they become bigger problems.
Yeah, I mean, I'll say, I know Heidi in the last panel had referenced a clinical tool we're developing out of our center. It's in terms of increasing buy-in, to even give this a try when it's new, it's not validated, it's fairly labor intensive. We know a clinical workforce has a lot of other stuff oftentimes within their agencies that they have to complete as part of patient care, expected by certain insurances to reimburse all of this stuff. I mean, I think it was really important in developing that tool and getting a cohort of clinicians willing to give it a try and to pilot it. It's really important to spend some time listening to their sources of pain around all of this, and then kind of framing this tool, though potentially labor intensive, because we're still working through the kinks. It's probably longer than it needs to be. We're figuring out how it fits in your caseload, that kind of thing, that actually really framing it as something that can help address a source of pain around typically when these clients come in. Yep, we have no idea what to do. We don't know, we don't really know how to think about the process of assessment and management of risk beyond to ultimately say, does this person require hospitalization? Yes or no? And they're just going to come back to me, and because they're going to be hospitalized for a few days and right back out. So it was trying to figure out what is that source of pain and how do we make sure that this tool is actually truly responsive to that, and then giving clinicians a lot of space to provide feedback on what was working and what wasn't working, and making sure we were truly open to hearing that feedback instead of just assuming, okay, it is what it is, it's intact, we're not going to change it. It was all really important for buy-in. What about, how do you know when you've landed on the right data for your evaluation? When you're actually really measuring the right thing?
That's a hard question. For me, I think it goes back to the blueprint that I mentioned earlier, and you can conceive that as maybe a logic model if you want, kind of like a visual representation of what your program will look like. So if you maybe ask yourself 3 questions. A, what are you trying to do?
Yeah.
How are you trying to do it? And how do I know that I did it, right? So if you can ask yourself and answer those questions, that leads you to the data that you need. Because it will, it'll structure the data that you need. If I'm trying, let's take an example on one of the programs that we just started to do an evaluation is NIAT. I'm not sure if people here are familiar with that. What is it? Not in our town. So it's a hate crime prevention program. It's a difficult evaluation because, well, for instance, let's say the outcomes. One of the things in hate crimes, you want to raise awareness of hate crimes. Well, if you raise awareness of hate crimes, you can go to raise the reporting of hate crimes, which is going to look like hate crimes go up. It's kind of counterintuitive to the idea of what you're trying to do, right? But that's what will happen. And so you don't want to be like, my big outcome is going to be, the number of hate crime reports. And I don't have a hard answer. What we're doing is taking a step back. We're looking at the entire structure of the program and mapping that all the way through. And once we do that, I think then we can sit down there and say, okay, this is the data that we need to make that happen. But you got to know what the program is, what you're trying to do, and how you're trying to do it in order to get there. Another issue with this particular program, and this speaks to the data piece of it, is it's a community-based program, right? So if you're trying to have a control group, which we didn't really talk about yet, but if you're trying to have a control group, what is your control? So you could have a community. So maybe you're comparing this county that it's been exposed to the program, that another county that has not been exposed to the program. So if you're comparing counties, you may have to be looking at longitudinal data. Because well, I don't want to get into sample size and stuff like that yet, but let's just say in order to, if your county was your unit of analysis, you'd have to have a lot of counties, and makes the evaluation extremely expensive, which gets really hard. So you may have to look at longitudinal data within the county in order to evaluate the program. But that, getting back to I guess my original statement, what you're trying to do, how you're trying to do it, and how do I know that I did it, will structure the rest of that. But it's a hard question to answer.
Very hard. Sarah, do you want to add?
The only thing I might add is also just looking at the literature and seeing how other people have measured similar programs and tools, and that you always want your research to be speaking back to that literature. So hopefully you're building onto it and you may be extending it in a different way, but that can also be helpful, I think, for reassuring yourself that you're on the right track with your plan.
Steve, please, you first.
I agree, and I think that's a good thing to do. 100%. I'll just add maybe a little example to that is that, and we didn't talk about this maybe in the beginning in terms of evaluation and whatnot, but if you think about your unit of analysis, I alluded to it earlier, and I didn't want to get too caught up into it, but if most of the times you think about programs that probably in your practice, you're looking at individuals, right? And individuals, if you're going to collect data, you're going to do surveys and stuff like that, that's fairly easy enough to do. But if your unit of analysis may be a community, like what I said, that gets harder, because then for individuals, you can get, maybe 500, 1,000, your sample size is large enough, in order to power their evaluation, you can find different effects. Communities, it's going to be very difficult to get 500 communities into an evaluation and compare them. And where would you get the data? You can't really survey a community, right? You can survey people in a community, but you can't survey a community. So then you're looking at maybe community level data like crime rates or something along those lines. And so once you get that, then as I alluded to, you start thinking longitudinally and how you would collect that data. And you're probably not going to be collecting that data. So you have to look at data that is already out there that someone else has collected, like health officials or police departments or things like that. So those are the things that you need to think about when you're thinking about the program, going back to those original questions. But I think, like you said, in terms of what can help you make those decisions, look at the literature, see what people have done, looking at, doesn't have to be the same exact program, but the similar problem and how they approached it.
Yeah. And I'm going to throw aside my research hat for a moment and just kind of think more like a frontline clinician. When I think of unit of analysis, it's like, well, who's the person I'm trying to help? Ultimately, is it a person? Is it a school? Is it a community? That's when we say unit of analysis, that matters, thinking that through, right? And for me, when I think about, how do I know when I've landed on the right data for evaluation, I do feel it's important to ensure that that unit of analysis, so to speak, has a role to in framing the evaluation. So, if I'm going to assess something, whether or not it's useful for clinicians, I really need to be open to hearing from clinicians themselves. How do they judge when a practice is useful? How do I know that they're actually going to incorporate something into their clinical load, for a particular patient? If I'm trying to work with a patient on something, it's important for me to hear from that particular patient, like how are they defining a problem? What is the solution? How would they know something was successful? These types of things are really important to think through when we say unit of analysis, kind of at large. But Please, Steve, you look like you're going to add something.
Yeah, I thought kind of maybe to tie in the
Yeah.
pieces of conversation that we've had, we talked about buy-in earlier. I think that's speaks a lot to the buy-in piece when, if I'm an evaluator coming in and you're running a program, we want to have those conversations up front to
Yes.
get that buy-in and
Yes.
for me to understand exactly how your program is designed to operate and how it's actually operating and, just how you think about all that kind of stuff. So those conversations up front are super important to get the buy-in, think about the data and all that kind of stuff. So it kind of all flows together.
Yes. Sarah.
Yeah, we have, over the last, I would say, even just 10 years, the time and effort we are putting into soliciting that buy-in and engagement from our community and school partners is getting earlier and earlier in the process of doing the work. A couple of years ago, when we were doing a study on that comprehensive school safety program, we had letters of support from local school districts in Colorado that, yeah, we'll partner with the University of Colorado Boulder to do this project. But one of the things we did not do was get the school district's IRB approval before we wrote the grant. So we wrote the grant, we got the University of Colorado's IRB approval to do the work. And then we had a huge school district that declined our IRB and they had no avenue for a resubmittal. So we were like, holy cow, that was going to be 30 schools in this project. We've really got to figure out and scramble to find another
That's a
district.
different word, but
Yeah. We were really in panic mode. And so we thought we had done the legwork to get the buy-in from all the school districts we needed. And we needed to go one step further. So we're now in the process of getting ready to do an evaluation of the state of Colorado's threat assessment tool for K through 12 settings. And we haven't written the grant proposal yet, but we are now working with school districts to say, do you want to partner with us on this randomized control trial? Yes or no? Okay, great. You do. We're actually going to get the district's IRB approval before we even submit the proposal so that we can just be sure that we've got the buy-in from the start. We're meeting with the school districts to actually write the research questions for the proposal so that it will be of value to them. And we're hoping that that will help anticipate any obstacles that we might have down the road. But yeah, we're moving it up sooner and sooner in the process as
Yeah.
we learn more.
So important. And I will say that sometimes, something that we struggle with at our center, and we've been very fortunate to have several at this point DHS CP3 grants that have built off of one another. And, getting buy-in, increasing readiness, sometimes these things are not included in your 2-year plan. How do you really do that and fit it in? And then also show that what you're doing matters, and starting these conversations as early as possible is so critical to getting it right and defining right the right way, but it's definitely a challenge with no easy answers, I would say. So what are examples of ways that practitioners can report findings from their programs, interventions, and impact that will resonate with funding agencies, local government? Speaking of challenges of funding, and there's never enough time.
I think it's sometimes it's sort of a bit of a public relations effort. You're trying to demonstrate the number of people you've impacted and the effectiveness of the program. And sometimes you're having to just navigate what is the best way to showcase that information. Sometimes it's the raw numbers, sometimes it's percent of the population reached. Other times it's being able to demonstrate the percent of shifts in the population. So I think it can vary from audience to audience on what's the best way to share and showcase that work.
I think I'm going to try to answer this question in two ways.
Please, go for it.
In terms of statistics and the nerdy side, well, first off, if you're communicating anything to policymakers or anything about fund, I would make it short, because people don't have time to read all,
Yes.
you know, the 20, 30, 100-page reports and stuff like that. And you're never going to be able to communicate that issue. So make it short. And I don't think this is anything new, but, you know, someone said to me a long time, anything really important can be communicated in 1 page or less. And I really think that's true.
Mhm.
You may, you know, I know people that I work with and work for, some of which in the room now would die of me saying that, because, you know, everything's got to be wordy and lengthy, because that makes it more important. But I do think that you can communicate short. But in terms of this, the nerdy part of it, the statistics, I always find, and I didn't start off this way, but I've been convinced over time. I like an effect size, because and without getting into technical detail, the effect size tells you basically what the magnitude of what is the magnitude of the effect of your program compared to whatever you're comparing it to. So just give an example. If we were, if we evaluated a crime prevention program compared to like say a probation, a kind of standard care. And we found that our program reduced recidivism by, let's say, 0.4. That's kind of what an effect size would look like, at least one effect size. I can now say, you know, compared to this other program, I can put a number in and say, I am X amount better than another program or something that you're doing. I think that's an effective selling point. There's a little bit more detail that I'll avoid in terms of going into effect sizes, because you really need a reference point. And for instance, just to give you a quick example, if I tell you it's 90 degrees outside, what does that mean? Well, we have a reference point because we know what 90 degrees feels like, because we've experienced, you know, 0. We've experienced 100. We know that 90 is hot. So that's your reference point, your everyday life living, you know, in our area. You kind of know what the low end and the high end is. For an effect size, you also need that. That's a little bit more difficult, but still, in terms of evaluation, we do have an effect size, and we know that in our particular context, our program was better than X, right? So I do think that's a selling point. The other piece to that is cost. If we can incorporate cost into the evaluation, oftentimes I like incorporating what is called a cost effectiveness study, where I incorporating the effect size or whatever statistic I'm using into the cost, so I can say it costs, you know, $1 to get, or say it costs $100 to get, you know, a percentage difference in crime rates. That's also an effective communication, because you're speaking to people's bottom lines in terms of cost. Now, we don't always have cost data. It's not always readily available, but if you can talk about cost, I think that is an effective tool. In terms of method, or were we going to get to that later? But because one of the things that we kind of talk about is like, how do we make those communications? And obviously we live in a world today where people are inundated with information. You know, you have Twitter, you have Instagram, you have the regular news, we have conferences like this, and you have journal articles, all this kind of stuff. I mean, do all of it. I mean, you hit different audiences, you resonate with different people. But I would just say, try to write to the audience that you're trying to communicate. Don't talk about effect sizes in a Twitter post, probably. But, you know, speak to the audience and try to communicate to the people you're trying to talk to, and what, you know, either policymakers, practitioners, researchers, and just try to speak to them.
Yeah, so important. I think all of it is a great recommendation because we've had a lot of success when we're pushing out of our comfort zone to disseminate findings in ways in which we wouldn't naturally think of. Like, for example, I am not a social media person whatsoever in any way, shape, or form. And pushing myself to engage in these types of things helps the work get out to a broader audience in some really, really important ways. Is one thing I want to go back to around practitioners reporting findings. I will say that, you know, when I think of, for example, some of our DHS funded projects, and we had these like wonderful performance monitoring plans, and sometimes what we proposed to evaluate didn't necessarily capture all the time the exact right things per se that we had hoped. One thing that has been really important is to communicate that back. So even if we're able to capture something, we're able to say something about this particular performance measure. It's also been really important for myself, for Heidi, for others within our team to help our funders understand kind of what we miss out on, though, with this data point, and why we weren't able to capture X, Y, and Z by just looking at A, B, C. And really explaining that very, very clearly helps to inform the work moving forward, helps to inform, too, the types of things that I think funders care about, in the sense of it helps to guide the funding source around what's important and why. So really making sure there's like a mechanism for giving that feedback and talking through those things, I think is really important. How about communicating information just to the mass public? I mean, we're getting into that a little bit, but when you think about the work that you've been doing to date, what are some strategies you've used to share information with the public as a whole on your evaluation results? How do you test? People were talking about telling their story earlier.
Yeah, I would say as academics, I work in a university setting. We are not very good at translating our boring research into really interesting, you know, pieces for the public to be consuming. One of the things we've been trying to do is use a public awareness campaign on violence prevention to disseminate some information about effective strategies for violence prevention on social media posts through the University of Colorado Boulder, through our DHS grant. And so we're in the very early stages of doing that work, and it is very labor intensive. You're taking research blurbs, translating that research blurb into a little bit more layperson friendly language, and then figuring out how do you put that into an appealing looking social media post that's not 6 paragraphs long. And it's very challenging. And even some of the terminology we use, we did some message testing with focus groups, and we learned that the audiences didn't want to see the word terrorism in a social media post about violence prevention. They were really concerned that that would create bias in people's responses. So they have helped us figure out, you know, what are better words to be using to convey this information, so that you don't scare people, but you educate them and help them see the value of some of these different strategies. But it's not easy, and it is labor intensive. It's not just something you can whip out on a Friday afternoon. It takes weeks, months to work through that process of the information, the message, and then the social media blurb, just as one example of getting it out to the public.
Well, you know, one thing that we do, and it's available to anyone, is, I think I mentioned in the beginning, we run a repository of evidence-based programs called crimesolutions.gov. So, I mean, obviously the general public can access that, and that's available to them. And we send out when programs are posted, I think NIJ sends out a blast to anyone on their list and stuff like that, which is great. But to your point, I think you're right. In general, it is hard to communicate uh, these, research findings to the general public because, I mean, let's face it, people, if their job is in criminal justice, whatever, you want to go to sports or whatever your pastime to kind of get out of that. So you don't want to pay attention to that on your off time oftentimes. So how do you break that barrier where people want to pay attention to a Twitter post or, I mean, Instagram or something? And so I guess I start thinking about, I mean, maybe like your point, we don't do this enough. I think I'd like to see more of a collaborative or interdisciplinary approach between researchers, I guess, and like media experts or public relations type people,
Yes.
and try to, how can you kind of break into that barrier of all that noise? And even if it is, again, keep it short, but just even if it is a blurb to pique someone's interest so they can then go, hey, look up the research study. I mean, again, maybe I'm a little bit of a, the geek world or the nerd world, but when someone does reference this study, particularly one that I may not believe, I often go look up the study, right? And I want to see what they actually said. Because is the media reporting it correctly? Are they just taking a piece of it and not explaining the whole thing? So, I think we need to look at the experts in order to communicate more effectively to a mass public. I mean, you're not going to reach everyone because some people aren't going to be interested, but for people who are going to be interested, or maybe this isn't their world, but it sparks an interest. I think we need to ask the experts or list them more.
You look like you were going to add something.
Yeah, I was going to add two things. One, we have found two pathways that have been helpful in the last 2 years in getting some of at least our project work in the Department of Homeland Security grants out to the larger public. One is through a website called conversations.org. It's a website that works with academics to try to translate research evidence and put it into layman's terms and get it out. And sometimes those articles get picked up by the Associated Press. And that's one avenue for getting information out there that we've had some success with. A second avenue has been partnering with the university's strategic relations office. And so we'll talk to them about a project or a study, and they'll nod their heads and say, okay, this is not going to make a great news story, but I think we can work with you, Sarah. And then they'll help us figure out how do we present this information in ways that would be more appealing. And then oftentimes they'll publish the article on the university's website, and then the Denver Post or another newspaper will pick it up and run with it. And sometimes that leads to other interviews, but that's been another pathway. But it takes having those relationships ahead of time to be able to make those things happen.
Those are great suggestions. I mean, this is very basic, but I'll just say it. I mean, sometimes I think another fault of academic institutions at times too is, that whole idea of sitting in an ivory tower, right? People are supposed to come to me to find out what they need to know versus me going out into public spaces and being a part of the mass public and having conversations and sharing what it is we're doing and what it is we're finding. I can't emphasize enough, with a lot of our projects, we found that it's really important to go out into the community, to have conversations, to be sharing your work, and to ask people, how do you make sense of what I'm saying? What are you hearing me say? Does this resonate with you? Does this make sense to you, right? Like having those conversations in the community has just been really, really critical. Really, really critical.
Sometimes finding the local professional associations, either in your state
Yes.
or region,
Yes.
that are addressing the topic that you are working on, and going to their annual conference and giving a presentation about your work can be helpful.
Absolutely. I'm conscious of the time. And I want to make sure the audience has opportunity to ask some questions.
Hey, so I've realized that there's a little bit of a gap between researchers and program implementers. So you have discussed ways that we can share information once we do have findings from research, but is there perhaps an opportunity to engage directly with programs who would have direct interest in your findings? So say you have been working on the past 2 years on something, you're like, oh, I know that there are some programs out there who might be interested, but maybe due to limited capacity or lack of awareness, they're not able to come to you to get that information. Could we see it the other way around to have this outward and very targeted way of sharing these findings with organizations that could benefit from it? Like verbatim?
So not the whole thing, but maybe the just, I mean, is the question, how, is there a way, maybe this is better. I'll repeat it to you. You tell me if I'm wrong. Is the question, how can researchers reach out to practitioners to communicate our findings? Is that the gist of it?
Yes.
Okay.
So let me just clarify. So it's kind of like a two-part question. One is, there is a gap. How can we bridge it? And two, can it be on the part of researchers to target organizations based on their understanding of their findings and how it can be applicable in the field?
Yes, there is a gap.
Yes, there's
Yes.
definitely a gap. I think part of it is if you're developing a tool that, I'll just give an example. We're working to develop a tool for law enforcement officers to be able to do a preliminary type of threat assessment, similar to the threat aid, but for law enforcement audiences. We have law enforcement officers on our project team, both who are in the field and who deliver training to police officers. So we have them on our team that's helping to develop the tool so that we can make sure we're incorporating that perspective from the very beginning. And then we'll pilot it with a group of law enforcement officers, and then we'll do focus groups with those officers and say, how's it working out? What did you think of the questions? What have been the challenges? And so that's ways that we're hoping to make sure we're including that perspective in the work.
I mean, I halfway joked because I mean, there is a gap, and one of the things that I, thought about is I was recently, maybe a year ago, I was at a conference of juvenile justice correction leaders. And it was coming right out of COVID. Well, maybe it was maybe it was 2 years ago now, but it was coming right out of COVID. And it was the first event where people got to be in a room together. And they seem to be just so happy and excited to kind of get out and just communicate with each other. And that struck me as like really important to kind of like the peer-to-peer learning type thing. And it did make me like, can we create a network of peer-to-peer learning as well as being researchers involved, where we can communicate those findings? So I guess the short answer, I don't think I have a good answer for you, but I think it's a good question. And maybe there's an opportunity somewhere where a network like, there should be some sort of online or electronic communication tool where you can make those networks and be able to communicate different findings. Because I think practitioners can learn from each other, and certainly researchers can chime in to communicate their findings as well when people are interested for them. I don't know that I found the exact right vehicle for that yet.
we are all convening for the Prevention Practitioners Network. So it is a network and an important one to be thinking about here in the ways in which this network can naturally.
I guess I'm thinking more on a day-to-day basis, you know what I mean?
Yeah. Oh, yeah. Well, and 100%. No, Steve, I totally agree with you. I'm just saying, it's an interesting opportunity with all of us here participating in a network to be thinking about that question and think through, are there ways in which the network can actually further support some of the day-to-day dissemination, collaboration stuff? Potentially.
Because I do think those vehicles exist in other interest areas, let's say.
Yes.
Because I think, I
Yeah.
mean, there's stuff all over for sports, right? You
Yeah.
can go on a bulletin board or you can communicate through other social media kind of platforms and things like that. I don't, I feel like we don't have the same thing for research topics and, you know, like social problem type topics. But I think there can be. I just, I guess I don't know how to build it. Speaking to the point earlier, like if you build it, will they come? I don't know.
Not always, no.
Because I don't know if there's enough interest out there to make it worth people's while. I hope there is. I mean, that's kind of, you know, what I do, but I don't know.
Well, this is some good foreshadowing, and to give some forethought to one of the answers of the questions we'll be asking on the survey momentarily, which is what can the Prevention Practitioners Network do to address some of these things? In the interest of time, we also had a few questions come in online. So one, it's been exciting to hear about some of the breakthroughs on measuring hate crime prevention. In the absence of previous studies, what are the recommendations for how to communicate the process of trying to uncover and measure prevention indicators? Comment, we're looking forward to communicating the evaluation process and progress with DSG in Not in Our Town communities. For us, this is part of the process and engagement, especially with communities we'll be studying with the Hate and Bias Action Team project.
One question.
What are your recommendations for how to communicate the process of trying to uncover and measure prevention indicators?
Yeah, I don't do much work explaining the process. It can be a bit of a snooze to explain how the sausage is made, I think. I don't know, but
Picarelli stepped out too. Brett Kubicek,
And-
do you want to answer this question? How do you communicate the process for identifying prevention indicators? How do you actually describe that? Are you willing to take it? Neil, why don't you ask the next question? We'll circle back to Brett.
All right, we've got another question. Could the panelists comment on how to communicate research and evaluation in the other direction to the communities the projects are working in, where populations may not see the relevance of, quote, big research to their daily lives?
I think involving those community partners from the get-go is really critical. I think gone are the days when we sat in an office and came up with research questions on our own. I think now we might have a research idea, but we immediately go to the people we think that idea may serve, and we'll ask, here's what we were thinking about, but what's going on in your school? What are the issues that your community is finding challenging? And how can we help? And then we use that process to formulate the research questions and plans for data collection together.
I think what you're talking about is what, I think there's a couple names for it, but it's called, at least in my business, it's called participatory evaluation.
Community-based
right?
participatory research.
So, yeah,
participatory-
so where you're really working with the community to develop not only the program, but also the research. So there's like a learning loop or I guess a learning loop, and in terms of what the evaluator is learning and what the community is learning. So you're really helping each other through the process. So if you approach it as a partnership, and if you approach it as a way for both sides to learn from, I think that's the best solution.
Yeah, and can't emphasize enough that you need to approach it really truly as a partnership, not just kind of a consultative or transactional relationship. It's got to be a real full partnership to get that right.
Emma, we phoned a friend.
Sure, phone a friend.
So I'm going to hand it over to Rick to address how to communicate the process for identifying prevention indicators.
So this is communicating the process, I guess, to whom matters, right? And so I'm going to answer it in the easiest one, not the hard one. So in communicating what that process means when you're trying to understand indicators to community of practice is probably the easiest one for me to address. I would refer to really unsatisfactory answer. I promise I'm not a lawyer, but it sort of depends on what you're doing. So we've sponsored a lot of research on not only on evidence to support specific risk indicators and evidence for understanding what types of methods or tools or approaches are appropriate for understanding risk in various settings. Not all settings are clinical. My partners in the UK, Australia, Canada, we've all sponsored a lot of different type of work meant to complement each other. And I would say that what we've heard today about sort of a combination of actuarial and clinical approach with informed professional approaches is really the best way to understand the problem, but explaining it means making sure that people understand that it's impossible to give an up, down, yes, no about whether or not someone is likely, or certainly going to commit an act of violence, right? And so this will probably make sense to a lot of people here, is you're making some kind of judgment, but ultimately it's going to be aimed towards what types of interventions or support are going to be necessary to improve protective factors to change the likely outcomes of their path of their decisions and behavior. I hope that answered the question. There were a lot of qualifiers there. Really sorry. No wonder you didn't.
As an attorney, I appreciate the qualifiers. All right. Neil, any other questions?
You have not received any last minute questions? That's it.
Emma, do you want to close out your fantastic panel?
All right. Well, thank you both so much for your willingness to have this discussion with me and with this lovely group we have here in person and online. And it's been a pleasure. Yeah, great conversation.